right? Okay, Do It For Me Insurance Inc. presents Medicare Basics 2024 edition. We're a proud partner, custom benefit plans. I also work there as a sales trainer. We will get into that too. So I'm Joe Covell. I'm the principal of Do It For Me Insurance Inc. I've been a licensed independent insurance broker since 2012. My role is assisting individuals and businesses with informed insurance choices. I'm also a broker manager and trainer for over 200 independent brokers at Custom Benefit Plans, where I've been since 2011. I'm collaborating daily with insurance carrier executives to enhance their product line. I have a diverse experience in multiple markets. I work in a bunch of different states and with a bunch of different products. And I'm a proud graduate of Penridge High School, class of 2004, and Temple University, class of 2008. Today's agenda, we're going to define Medicare, original Medicare, Medicare Advantage, prescription drug plans, Medigap and Medicare supplement policies, same thing, enrollment periods, starting the process, and any questions you might have. What is Medicare? Medicare is a federal health insurance program in the United States. It provides coverage for individuals who meet certain eligibility criteria. Who is eligible for Medicare? People age 65 and older. People under 65 with certain disabilities, including end-stage renal disease, people who have worked and paid Medicare taxes for a certain amount of time, usually at least 10 years, or they say 40 quarters. Also, if you didn't work but your spouse did, most times that counts too. But again, you want to check with Social Security on that. For more detailed information, though, visit Medicare.gov. What is a Medicare beneficiary? This actually terminology, I felt the need to do this slide because this actually confuses people. When people sign that application, they think beneficiary like it's their spouse or their kid or something. That term kind of messes with them a bit on the application. A person who's eligible for Medicare is known as a Medicare beneficiary. This term can be confusing to consumers when enrolling in Medicare plans and policies. When ready to finalize, qualified customers should sign where applicable for a Medicare beneficiary to sign. So that'll be a line on the enrollment form. There are 4 parts to Medicare. Part A and B. So A is free for most people who have worked or paid Medicare taxes for 40 quarters. Part B is the portion that most people pay for. Those collecting Social Security will come out of your check. So a lot of people don't even know they pay it. Or that's our favorite TV ad, check my zip code, get my Part B paid for. So that's what that's going after, and we'll discuss that benefit too, why that's a thing. And then the other 2 parts are Part C, which is Medicare Advantage. So that's confusing to people, right? So you usually either have A and B, which is original or traditional Medicare, and then you pick up a private Part D plan from an insurance company, and then a supplement, which is neither of these parts. It's just a plan that covers what A and B doesn't. Part C replaces A and B. So what's going on there is the government is paying an insurance carrier of your choice a set amount of money every month, and the agreement is that they're going to give similar benefits to A and B, and you know, something in addition, the hearing, the dental, the over-the-counter allowances, the trips to the doctor, getting your Part B paid for, check my zip code, right? Those are all those extra benefits. So what are you missing those benefits? That's what that whole pitch is. So again, original Medicare, Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, and home health care services. Part B covers doctors and other provider services, ambulance services, durable medical equipment, mental health, limited outpatient prescription drugs. So Part B drugs, a common one would be like a chemotherapy and injectable. That doesn't fall under Part D, that tends to fall under Part B. Original Medicare continued. Part A, Medicare A is premium free for most taxpayers. If you paid Medicare taxes for less than 30 quarters, the standard Part A premium for 2024 is $505. If you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium is $278. So again, if you just came here to the country, you didn't pay enough taxes, you didn't work, whatever the case may be, or maybe you brought an older family member over that didn't work those quarters, you do pay that. There are instances in which it's paid by like a state, like a Medicaid program too, if someone qualifies based on low income. So sometimes that is picked up. So, just if you just came to the country and you're thinking, oh, I don't qualify for Medicare, that's not always the case. Like, let's discuss that and discuss your options, because there are programs like the marketplaces, the state and the federal marketplaces like healthcare.gov. They have opened that up to take people that have to pay for A or may not qualify for A and B. So we tend to have a fit for just about everybody we come across. Medicare Part B has a monthly premium everyone must pay. Most people in 2024 pay $174.70. That's the new amount. It's around 164 and change now. It's going to 174.70 in 2024. So it is going up. It went down last year, I believe it was 23. I think it took, or 22. One year it went down, but it's going back up again. As per the Income Related Monthly Adjustment Out, IRMA, which is a federal government legislation, surcharges will apply for some. So what that says is, depending on your income, and we're going to get into that chart, you could pay more for Part B, depending on what your income is. Also, if you didn't pick up Part B when you were supposed to, you can assess a 10% penalty if you didn't have other credible coverage. Original Medicare other costs, inpatient hospital deductibles. So again, these are the 2024 numbers I found. That's $1,632. Daily copayment, formerly called daily coinsurance, so they changed the terminology. For day 61 to 90, that's $408. Daily coinsurance for lifetime reserve days is $816. Skilled nursing facility coinsurance is $204. Part B deductible is $240, so that's up from $226 and $23. Immunosuppressive drug premium is $103. That is also up. Getting into IRMA, so decrease from 2023. Income related monthly adjustment amounts. So the charts have changed. I didn't be a big convoluted slide to show you 23, but these amounts have changed. All these incomes amounts have changed. They've gone up. So 174, these are the different brackets in which the premium you would pay. And then if you're just getting immunosuppressive drug coverage, here's your premium based on income. This is for your Part D. So they don't just make you pay more for Part B based on your income. You can also pay for Part D. So if you have a Part D plan that's $100, you're tacking on this amount on top of that every month. And that is assessed by the company you go with. So in most cases, your Advantage plan or your Part D standalone PDP prescription plan, they're adding that to that. That's how they're getting that. Part B's penalty is just getting added to the amount that you pay Part B. So if you're collecting Social Security, it's coming right out of the check. If you're not collecting, then you're physically writing that check quarterly, or you can do bank drafts. I'm not the expert there. Get in touch with Social Security for paying your Part B and such. Part B, IRMA, married filing separately. So they get you there too, right? People, oh, me and my wife file separately. No, actually the income's even a little more drastic there. So they're tuned into that. So these are the amounts you would pay in those instances, and also for the immunosuppressive drug coverage only. And then married filing separate in terms of Part D, those are those amounts. What is immunosuppressive drug coverage? Otherwise known as anti-rejection drugs, or drugs or medications that lower the body's ability to reject a transplanted organ. If a Medicare beneficiary qualifies for Medicare due to only end-stage renal disease, the coverage generally ends 36 months after a kidney transplant. As of January 1st, 2023, that was this year, there was a new benefit, or is a new benefit, to continue to pay for those drugs after 36 months if there is no other health coverage in that instance. Only the drugs will be covered and no other items or services. For more information, here's the link below. We'll try to put that in the footnotes too. Final two parts of Medicare. So these are the private sector in a sense. These are what you're buying through an insurance company. So Medicare Advantage, Plan C, and Prescription Plan Standalone Part D, or an all-in-one Medicare Advantage Prescription Drug Plan, MAPD. Medicare Advantage. Government-sponsored option to receive benefits of Medicare A and B through a private health plan of your choice. Help pay for your out-of-pocket costs under Part A and B. Many plans include Part D prescription drugs. Many plans include additional benefits such as vision, hearing, wellness services, dental, over-the-counter allowances, gym membership. Everybody loves their silver sneakers and equivalent. Healthy foods and more. Must be enrolled in A and B to be qualified for Medicare Advantage. Most plans have defined networks: HMO, PPO, private fee-for-service, HMO POS, cost plan, etc. Part D prescription drug plans must be purchased in addition to Medicare Parts A and B. You do not get that from Medicare, you get that from a private insurance company. That's what we help you with. We help you with the C, the D, and the supplements. Offered by private Medicare approved insurance plans. The national base beneficiary premium for 2024 is going to be $34.70, and that will make sense a little later as to what that number means. High income enrollees pay a higher price for Part B and Part D as per the federally defined income related monthly adjustment amount, IRMA surcharges, as we previously covered in the prior slides. Okay. Part D. So a little bit of the big change that's coming for 2025, but this is for 2024. So phase one, the new deductible maximum a plan can have is $545. The new donut hole or coverage gap begins when you reach $5,030. What is this? This is the total cost of the drugs. What you and the plan, or simply put, maybe look at the retail cost to get that idea. When the total spending on the meds, not just your copays, what they're paying to the plan, when that reaches that amount, you go to paying 25% of the cost of medications. That's where if you had a friend, or if you're or family member, or you've experienced it yourself, your prices just skyrocket in the middle of the year. That's why, because you reached that amount, now you're paying 25%. So something like Eliquis that may be, say, $800, and you met your deductible, paid that right away, and then you're paying like $47, or, well, that's a bad example because the Eliquis went up on a lot of tiers in 2023. So, but anyway, 25% of $800 is typically more than the copay was in that initial phase after the deductible. So what's changing now is the catastrophic amount is $8,000. That went up, but now you are done. So before, after that, you would still pay 5% till whenever the year ended, basically. Now, that's a hard stop. That $8,000 is a hard stop. So that's the first, and more is going to be coming in 2025, which we'll cover a little later. Big changes for 2024. We're going to cover right now. The Inflation Reduction Act of 2022 includes several provisions that will lower Medicare Part D costs. Lower prescription drug costs, $35 a month cap on insulin, $2,000 yearly cap on out-of-pocket costs. This is going to start in 2025. We're building up to that. Negotiating drug costs, limited price increases to inflation starting in 2025. Expanded access to preventative care, cancer screenings, and vaccines. Financial assistance for low-income beneficiaries. The LIS program, or Extra Help, has expanded eligibility. Increased LIS financial assistance. So that's great news there. Potential for skyrocketing Part D premiums. So nobody really knows, carriers, anybody I've talked to, and I talk to, this is my job, right? I help brokers as well as customers. Nobody really knows what 2025 is going to bring, and a lot of companies are getting nervous. Some are saying there may never be another $0 premium again. We don't quite know the ramifications of this until we get closer to 2025. So as great as that sounds, it's going to reflect on plan premiums. Again, speculation at this point. Drug manufacturers required to pay rebates to the government if prices for certain drugs increase faster than inflation. Drug manufacturers may increase drug prices for other drugs to offset the cost of the rebates. 5% co-insurance requirement for catastrophic coverage eliminated in 2024, which we just went over. Beneficiaries who use a lot of expensive drugs may have higher Part D premiums. Most of us, if not everyone out there is going to probably experience that, unless the premium is getting paid by the state or an LIS or Medicaid or something of that nature. I could definitely would say expect premiums to go up in 2025, but we'll take it 1 year at a time. Overall impact, mixed impact on Medicare Part D costs for beneficiaries. Could lower prescription drug costs and expand access to preventative care. Could also lead to higher Part D premiums for some beneficiaries. Full impact of the law is still being debated. Help with drug costs. Medicare offers a program known as Extra Help, or LIS, which we just kind of briefly touched on, for limited income and financial resources. The program is also often referred to LIS, low income subsidy, and can help pay for Part D plan premiums, deductible, co-insurance, and co-payments. This is a fantastic program if you can qualify for it. It can also pay for Part D late enrollment penalties. Generally, individuals with an income limit of $21,870, these are 2024 numbers, which are up, and a resource limit of $16,600, and for couples, those are $29,580, and a resource limit of $33,240, which we'll go into later. Can qualify for LIS Extra Help. Pricing varies based on income level. For more details and how to apply, please refer to medicare.gov/basics/cost/help/drug-costs. The Inflation Reduction Act and LIS. The new prescription drug plan, i.e. the Inflation Reduction Act, will help those who qualify for the Extra Help program even more. In 2024, everybody who qualifies for Extra Help LIS will pay zero Medicare drug plan, monthly premium, zero plan deductible, and reduced amount for prescriptions. These are actually up a little bit, couple, some cents. They were around $4.15 in 23. So these are up, but they're still better than if you didn't get it, because a brand at $11.20, I mean, brands can be $50 higher, donut holes, you name it, right? So that's a fantastic program. Partial LIS is being phased out on 1/1/24, meaning that full LIS program will be available to everyone. So there's no longer a partial LIS. So anybody under 150% of the poverty level will get the same benefit. Before, it was 135 to 150 was a partial level, so that's gone. What are considered resources for LIS? Money in a checking, savings, or retirement account, stocks and bonds. What are not considered resources for LIS? Your home, one car, burial plots, and up to $1,500 if set aside for burial costs. Furniture and other household and personal items. You can apply at ssa.gov/extra help or call the number, or also more info at medicare.gov/extra help. Help with drug costs continued. So aside from LIS, many states offer state-run programs to assist with higher drug costs. To see what's available, you can check out this article from medicare.gov. When becoming eligible for Medicare, often manufacturer coupons and programs can become void. So a lot of those copay cards that you'll get will say, can't be used with Medicare or government programs. I always encourage people to call anyway, just to see, hey, I'm on Medicare, I can't afford this prescription. What can you do to help me? Here's a convenient article that I found. And also, utilize things like GoodRx. Many times customers tell me, hey, I got that cheaper on GoodRx. Just because you buy a drug plan does not mean you need to use it. You just need to have one in most instances so you don't incur any kind of fines. if all your drugs are cheaper on GoodRx, you just get yourself that cheap plan in the market. And why it's so low, we're all kind of speculating. But hey, that's a perfect safeguard for Medigap plans, also known as Medicare supplements, sold by private insurance company, fills the gaps in original Medicare, Medigap. Example, Medicare Part B generally pays only 80% of the bill. Medigap policies help cover the portion for which you are responsible. You must be enrolled in Medicare Part A and B to enroll in a supplement policy. Medigap policies are standardized. So just for talking points, everybody's plan G, plan N does the exact same thing. Some maybe give you little bells and whistles, like a gym membership or a wellness program of sorts, but the government standardizes these. And they do not offer Part D coverage. They did a long time ago. Some grandfather plans, I think like a Plan J, still have prescription benefits. However, those are not credible anymore, and those people still need to have a Part D plan if those benefits are even still in those plans. Medigap plans, generally, Medigap policies don't cover long-term care like a nursing home. That falls under long-term care. That's a whole different animal, right? Nothing's covering that. And as of right now, for the majority of people, unless you're on maybe state coverage or something, or you have a long-term care plan or a program in place. But yeah, that's a real topic that keeps people up at night. And long-term care insurance, we do it, but it's very, very expensive. And you usually have to get it when you're younger, like 40, 50, and it's something you pay forever. And chances are you may never go into a nursing home. So you could have paid all that premium and got nothing out of it. So, again, we can analyze that or talk about different options such as annuities, things of that nature. That's what we do. Some Medigap policies cover travel outside of the US. Great option for people who are currently receiving or seeking ongoing medical treatments. The best time to buy one: must be enrolled in Medicare Part B. This is your open enrollment period. This is a one-time period in most cases. This is not an annual period. If you don't sign up for a Medicare supplement policy during this open enrollment period, you may not in the future be eligible to enroll because it's based on underwriting unless you have a guaranteed issue right. What's a guaranteed issue right? I had a Medicare Advantage plan and I moved, I left the service area, I would get a guaranteed issue right to buy that. My plan stopped offering coverage, canceled me, that would qualify. Certain other things like Maryland right now, I believe has loss of Medicaid would count. And I believe Oklahoma just passed a law that if every year on your birth month, you're going to have a 60-day window in which you can switch your plan to another carrier or downgrade. Do not believe you can buy one if you do not have one at this point. Again, it's not. I have a license in Oklahoma, but it's not quite my wheelhouse. Okay, and here's the Medicare supplement chart. So the most common sold are G and N. F is only available to those who were on Medicare prior to January 1st of 2020, along with Plan C and high deductible F. The only difference between F and G is the Part B deductible, which is $226 this year, and then again, it's going up for 2024. So F did cover that, G didn't. Most times the cost savings between the two, G was worth it, even when people were still able to buy F. But some people still like F because it just pays for everything for the most part. Again, no prescription covered, right? And it's Medicare expenses. So if Medicare covers it, the plan covers it. Usually doesn't matter what supplement you have. As long as the doctor takes traditional original Medicare, they're going to take whatever supplement you have. K and L had some changes to the numbers, which I updated. Again, people do buy those, but I don't have much experience with them, at least in this market. I have had a few high deductible Gs. That deductible amount's gone up to $2,800 for 2024. Enrollment periods, initial enrollment period, the 7-day window that straddles your 65th birthday month, 3 months prior, your birth month, 3 months after. Medicare supplement open enrollment period, the 6-month period starting the first day of your 65th birth month. General enrollment period and open enrollment period, January 1st to March 31st of each year. Let me go back on this Medicare supplement. So again, you turn 65, that's the time to buy a supplement, or you just got Medicare. If you left work coverage, if you didn't have your B, or you did have your B, those can change depending, in the situation. But essentially, you have your birth month and 5 months after. You can buy a plan every day of the week if you want. They have to take you no matter what. After that 5 months is over, they're going to ask you health questions. They can rate you up. They can deny you coverage. So even if you have no intention to buy a supplement, I always make it my mission to explain a supplement to my customers. To this day, most of my customers have supplements. I'm a big fan of supplements, but I see the needs for both. It's all about your prescriptions, your doctors, and your utilization. There's no one size fits all. Initial enrollment period. Enroll in Parts A and B. Enroll in a prescription drug plan. Enroll in a Medicare Advantage plan. If you don't sign up for Medicare Parts A and B or Part D when you were first eligible, you could face penalties that raise the price of your monthly premiums. General enrollment period. You may also sign up for Medicare Part A and or Part B between January 1st and March 31st each year if both of these conditions apply. You did not sign up when you were first eligible. You are not eligible for a special enrollment period. That pertains to you. Reach out. I'd love to help you with that. I have seen the craziest situations. I love them. That's what we excel at. And bring me your best challenge, and we're going to do our best to get you through it. The annual enrollment period, which starts tomorrow, October 15, 2023. You can make changes and enroll in a Medicare Advantage plan during this time period. If you have original Medicare, you can switch to a Medicare Advantage plan, or you can actually get out of it too. You can switch from a Medicare Advantage plan with drug coverage to one without, or vice versa. You can join or drop a Medicare prescription drug plan. You can also update your coverage by switching to a new plan from your current insurer or from a new insurer. If you choose to make a change during the annual enrollment period, your new coverage will begin January 1st. The open enrollment period, not to be confused with the AHIP and the open enrollment of a Medicare supplement. During the January 1st to March 31st, which used to be the general enrollment period too, or election period, those in a Medicare Advantage plan can make a one-time switch. So this can't be advertised. This is something that we can tell you, but they can't advertise this on TV directly. But during that time, if you have an Advantage plan, you can make a one-time switch to another type of Advantage plan, another carrier plan within the same. The OEP cannot be freely advertised like AEP, but plans and brokers may inform consumers when you inquire. Medicare Advantage plan enrollees can also disenroll from Part C Advantage plan and return to original Medicare, as well as enroll in a standalone drug plan. However, that does not give you an open door to buy a supplement. Again, medical underwriting is usually going to apply unless you're within your trial right or there's some other circumstances, or you're in a state where there's open enrollment. There are states that just let you buy it no matter what, whenever. So every state kind of handles this differently. Medicare Advantage trial right. Medicare supplements offer a free look period of 30 days for Medicare beneficiaries to decide if they wish to keep the policy or not, whereas Medicare Advantage plans offer a trial right in specified circumstances. If a Medicare beneficiary drops original Medicare and a Medigap policy to enroll in a Medicare Advantage plan for the first time, they have 12-month period to change their mind and return to the previous policy available. They go back to the plan they left. They can't just pick anyone unless their plan doesn't exist anymore, in which case then they'd have a guaranteed issue to go to somebody else. If the previous policy is, again, the carrier and plan they left. If the previous policy is not available, they can buy another Medigap policy with another company available in the zip code. Yep, which we just covered. Part C trial right continued. Medigap policies are no longer permitted to offer prescription drug coverage. We talked about that. Even if previously included, enrollment in a standalone Part D plan may be available. If a beneficiary joins a Medicare Advantage plan when first eligible for Medicare, they can choose from any Medigap policy within the first year. Some states provide additional special rights. For more on guaranteed issue and trial rights, here's a great Medicare.gov article. And again, we'll try to put the links in the YouTube video description. Medicaid and Medicare plan options. Medicaid provides health coverage to millions of Americans, including eligible low-income individuals. Medicaid is administered by states and funded jointly by state and federal governments. Insurance carriers offer those with Medicare and Medicaid eligible Medicare Advantage plans called dual special needs plans, or what we could say is DSNPs, with network options and extra benefits. These plans have governance over who can apply, when they can apply, and how often they can switch plans. This used to be that they could switch year-round, once a month. Now it's quarterly. And it's not all those with Medicare and Medicaid. There's a specific levels. There's Slim B, QMB Plus, a few other ones there. So normally this process is we would get your Medicaid number. We would call a carrier that we were interested in enrolling with, see if you qualified. They would tell us if you were eligible or not. Most companies in the Philadelphia region don't do partial anymore, though I do believe one or two are still doing it. So that comes and goes, but normally you have to be a certain level to qualify for the DSNP. And then if you lose that eligibility, they have to keep you for a certain amount of time, but then you have the co-pays again. So typically when you have Medicare, Medicaid, they kind of pay what the other one doesn't pay. You're doing the DSNP because you care about those extra benefits. Those are the things you see on TV talking about your electric bill getting paid and pet supplies and things of that nature. Those are Medicaid, Medicare, DSNP type benefits, because they're trying to attract that person who doesn't necessarily need that plan. So why do they want to go to that plan? Maybe a doctor doesn't take Medicaid. Going to that plan allows them to see a network of doctors. If I have Aetna, now I can go to an Aetna doctor. Maybe my doctor didn't take Medicaid, but he takes Aetna, HMO, Medicare Advantage network, or whatever the network might be. So they're, and it's about the extra benefits. Usually the over-the-counter allowances are much higher, and the dental benefits are much higher, and also that there's some money available for food and for utility bills and rent even. So yeah, that can be great. People really like those benefits, and there's a lot of fraud out. Solicitors call Medicare beneficiaries, say, oh, you might get your electric bill paid. Meanwhile, the person's got a $50,000 income. So it's like, there's all kinds of fraud. They just want to talk to you. Don't be giving your Medicare number out to someone you don't know, because they could put you in a plan before you know it. Aside from annual enrollment period and special enrollment periods, DSNPs can also be changed once per quarter, except for the fourth quarter. In the fourth quarter, you would be using the AHIP. Chronic condition special needs plans. Chronic condition special need plans called CSNPs restrict enrollment to individual specific severe or disabling chronic conditions. Chronic conditions require a coordination of primary care physicians, specialists, and mental health providers, including inpatient and outpatient facilities. Often extensive ancillary services, diagnostic testings, and therapeutics are required. One or more comorbid and medically complex chronic conditions which are disabling or life-threatening. CSNPs are available depending on an individual's geographical location. So these vary based on your market like anything else, right? To check your zip code, that's why they say that. Institutional special needs plans, we're really getting in there, huh? I-SNPs are designed for Medicare beneficiaries who are for 90 days or longer have or are expected to need the services of a long-term care, skilled nursing facility, or other eligible institution. Certain I-SNPs that operate single or multiple facilities can establish county-based service areas if there exists at least one LTC facility that is accepting enrollments and is accessible to county residents. So yeah, some of those plans out there, right? Like Erickson facilities or Sunrise, or again, we're talking Philadelphia region, they're all over the place, right? All over the country. So those facilities have those plans of their own. That special enrollment periods. What if you're outside of everything we mentioned? There are many different special enrollment periods that exist, which allow an eligible individual experiencing qualifying life event to enroll or change their Medicare options. Usually the enrollment must occur within 60 days of a qualified life event. So what would this include? So here in the Philadelphia area, the I-95 bridge had that accident. That was a special enrollment period. That allowed someone to buy a Medicare Advantage or switch or Part D. That was an election period that existed not all that long ago, within the last couple months. Example include loss of employer union coverage, gaining or losing eligibility for LIS, moving in or out of a planned service area, natural disasters, like I just said, and many more. Refer to Medicare.gov for this article and more info. Medicare.gov is a great resource. There's a lot of great information on there. You can also do plan comparisons. Medicare savings accounts. MSAs. So in the Philadelphia region, I don't believe we have any anymore, at least that are available like for an individual to buy. Compared to health savings accounts, Medicare savings accounts are designed to work for Medicare beneficiaries. MSA it's basically an HSA before someone on Medicare. Has a high deductible with little to no coverage prior to satisfying that deductible, right? So like with those plans, it would be like they'd have an $8,000 MAC deductible, but then the plan was also funding the account with $5,000. So meaning they would have an out-of-pocket of $3,000. So they were interesting plans. There were a few people that did buy those. And again, I don't know of any now, but I'm not the complete expert on that. Unlike private HSA plans, MSA plans deposit money into qualified individual bank account to use for medical expenses, as discussed. MSA plans do not cover Part D, and therefore an additional standalone Part D plan will in most cases be needed. Plan benefits, deductibles, enrollment periods, and other nuances are different from typical Medicare Advantage. Yet when you can join and leave them, that gets a little nuanced and owing money back and whatnot. Private fee for service and cost plans. So what they're a type of Medicare Advantage plan. Unlike traditional Medicare Advantage and Medigap policies, the PFFS determines how much it will pay providers and how much the member will pay when receiving care. They may or may not offer Part D coverage. Standalone plans can be purchased if the plan doesn't, and you can bring the one you have or buy one or switch or whatever you want to do there. Members should make sure providers agree to treat under the plan and accept the plan's payment terms before services are rendered. Medicare cost plans are available. So Medicare cost plans, different one, are available in limited areas in the US. Enrollment is allowed whenever the plan is accepting new members. Members can leave anytime to return to original Medicare and are permitted to purchase a separate Part D standalone plan. Individuals with Part B only may join, and those with Part A and B are covered under original Medicare when seen by a non-network provider. Members will pay the Part A and Part B coinsurance and deductible. I'm not an expert with this one either. The AHIP test is test that everybody who sells Medicare space is required to have a certification. It emphasizes this completely, so I'm familiar with it. I wanted to cover it because I don't know who's watching. I cover a large service area. Maybe you have a cost plan in your area. So I just kind of wanted to touch on it. But I just don't have any personal experience on it because in my world and career, I just haven't come across it. The PFFS too, AHIP really emphasizes, and AHIP is the body that certifies agents. That's a master certification, and then there's certifications for each carrier that we take every single year. To my understanding, it was the doctor has to agree to the terms and could choose to stop taking those terms in the middle of the year. Although from what I'm hearing by the carrier that's offering it in my area, if they're in the network of the plan already, then they've already agreed to that term. And most times if they're in, they don't leave in the middle of the year like that, but it can happen. It's emphasized. So that there's some nuances that, we all got to understand. Are you happy with your current coverage? If you or your spouse work for an employer that has more than 20 employees, you can wait until retirement, separation, loss of coverage to enroll in Part B in most cases. But again, check with the HR department. Certain unions or so might want you to have that be. Employer coverage is the primary, and the Medicare is secondary. If you or your spouse work with an employer that has less than 20 employees, it may be necessary to enroll in Part B. It's very encouraged, but I would still coordinate your intentions with Social Security and Medicare. Again, Social Security administers it. Just say, hey, I'm working still. I want to put it off. And they're going to ask you those type of questions to help you determine that. It is really advised that you do, because there could, for any other reason, be claims issues, whether or not you're going to get penalized or it's a problem, because in that instance, Medicare is primary and the plan is secondary. So Medicare is the one that wants you to have Part B because they're the primary payer. So like if you didn't, And maybe you're not going to get penalized, but there might be a claims issue in which they're saying, I'm not going to pay that bill, you didn't have Part B. So there could be that kind of claims issue. So it's just, if you're under 20 employees, it's really a good idea to take B. If you're currently covered by the Federal Health Insurance Marketplace, a state-based health insurance exchange, or COBRA, the rules can get a little complicated. COBRA is not considered qualified coverage as of today, so that gets a little hectic. So, we talk through that too. You don't really want to go more than 63 days, or you get into the area of getting some penalties, which leads to that. Part B late enrollment penalties. Medicare Part B late enrollment penalty. 10% penalty for each full year of delayed enrollment after those 63 days if you don't have other qualified coverage. Added to monthly Part B premium. Exceptions exist, such as having credible health insurance coverage during that period of delay, or state coverage, and different things, right? Those with credible employer coverage. If you have employer-sponsored health insurance with Part B, you have 8 months to enroll in Medicare Part B without a late enrollment. So this is, you're working for a bigger employer, whatever it might be. You had A, but not B. You go to pick up B when your coverage ends or you retire, so on and so forth. You usually have the 8-month period. You have 8 months from the month your employment ends or your employer-sponsored health insurance coverage ends. If you don't have employer-sponsored health insurance with Part B, you have 3 months to enroll in Part B without a late enrollment penalty. You have 3 months from the month you turn 65. Contact Social Security for more information and assistance regarding when to delay or enroll in Part B. Again, so that's the government, right? People ask us all the time. We always say there's 3 ways to do it. You call the number, Social Security, or if you call Medicare.gov, they're just going to give you a Social Security number below there. And that's going to coordinate you with local offices if you want to go in person, or go Medicare.gov, right? So A and B is government run. We have little to do with that. They don't want us to do stuff with that. We just, give the best advice we can and kind of put you with the right help that you can get. Part D late enrollment penalty. So D as in for the drug plan. Maintaining Medicare CMS credible prescription drug coverage is mandatory, ensuring no coverage gap exceeding 63 days. Failure to meet this requirement typically results in an enforcement of a late enrollment penalty. So a D penalty too. To calculate this penalty, that's where that 3470 number comes in. You take the full number of months that you went without credible coverage, you times it by that 3470 amount, this is 2024, times that by 0.01 or 1%. So if we had 60 months without coverage, we're paying $20.82 on top of whatever we buy. So the plans add this to the price, but the government's the one that's telling them what to do. So you can't outsmart them there. You can't say, oh, Aetna charges, I'm going to go to Humana or whoever it might be. Government's going to say, okay, Joe migrated from Aetna to Humana. Humana, you need to charge that fine on top of his premium. So they're triggered when you go to buy something that has Part D coverage. So like I'm saying, when you first turn 65, you don't take any meds, you don't want to buy a drug plan, because you never know when you might want to get drug coverage for drugs in the future. Maybe you want to do an Advantage plan. You don't know what the future holds. That penalty does not stop. That just keeps on going. So, I mean, I've dealt with people in their 80s and they're looking at paying $100 on top of their plan. And that's limiting their decisions. Maybe they're buying a plan that doesn't have drug coverage, or they're not having drug coverage. I mean, that's, the Medicare only options can be very lucrative in terms of benefits. They can also be limited to where you're at. Medicare Advantage plan and Part D, they change just about every year or so. They can drastically change. So you never know what you might want in the future. And again, this amount is added to your Part D, Part C coverage for the rest of your life, unless you can somehow convince them to get you out of it, which most people can't, or it's picked up by a federal or state program like Medicaid or LIS, depending on where you're at. Is your mailbox full of flyers? I know mine is, and I'm not 65. My dad has the same name. He is, but we live 20 miles apart. And the person before who owned my house was on Medicare. So I don't know, but either way, my mailbox is full. I'm sure yours is. If you're approaching 65 or already in that age bracket, you probably receive a lot of mail from solicitors. Solicitors are not permitted to call you regarding Medicare plans unless you have previously given permission by filling out a form online, through the mail, or in person at event or retail kiosk. Went to CVS, a guy sitting there with an Aetna tablecloth, and says, you want to talk about plans, you fill out a permission to contact form. Well, he can contact you, and there's it varies year to year how long that can be. If you filled out that form, that's why they're contacting. If you have not filled out that form and you expect any kind of fraud whatsoever, it is highly encouraged that you contact Medicare. They're there to help you, right? Call them, go online, report that fraud, because it's abundant and it's getting worse all the time. Important mail will come from the Social Security Administration and Department of Health and Human Services. A lot of those solicitations from third-party marketing organizations are going to confuse you. I get texts every day, and I don't mind. Please do it. I'd rather you not buy the wrong plan, even if you're not my client. I'd rather you not buy the wrong plan. I really wouldn't. Things look like they're official and they're not. So, most times, they're like the IRS, they're not making outbound calls too. So like really vet that out before you go giving that information out. You can usually see them a mile away, especially with a cell phone. You usually can flag spam and such. We can help you determine what is important mail and what is an advertisement, even if you're not our client, right? Okay, if you suspect fraud of any kind, again, just contact Medicare. That's what they're there for. Start the process. And to talk more about compliance, right? As agents, they're really on us when we do events, what we can and can't say, what we can collect, how much we can put into gifts or light snacks. I mean, they are really on us as agents. Our commissions are set. They are standardized for most plans, like especially Medicare Advantage and Part D plans. So that's good for you, because really, there's no incentive for an agent to switch you other than to become your agent. We as agents get paid a residual amount, and it does not come out of the plan. Someone is getting paid when you buy a plan, whether you're calling a carrier directly, going on a website, calling a number on TV, somebody's getting paid. It's all standardized. It's not reflective in the premiums for Medicare products, at least for the most part. We're also required to disclose our commissions. That was a law that was passed. So I'm totally upfront about that, right? So as a broker, I want to keep my clients happy. If that means you keep whether you keep the same plan or you switch a plan, agents are going to make the same amount of income. So there really is no reason to talk you into something that you don't want. I mean, you shouldn't do that anyway, but there's no incentive there. So when those call centers are calling, it's because they're trying to get you as a client or whatever it might be. And when you're dealing with someone at a call center, good luck trying to get them again, because most times they're hourly employees that got licensed and they're out the door as fast as they came in, or they're working in a busy atmosphere. Steps to take to get the ball rolling: register for Social Security or sign up for Medicare Part A and B. Confirm your enrollment date. Talk to an AHIP CMS certified agent or broker, such as myself, who will help with the initial enrollment and will also be available for questions and help throughout the year. Again, text, call, email, any weird stuff you get in the mail, I'm happy to take a look at it for you. Don't go calling numbers and risk, getting yourself coverage you didn't want, right? Review and enroll in a supplement policy or Medicare Advantage plan. Review and enroll in a prescription drug plan, if not provided elsewhere. Important decisions. Once enrolled in Medicare, you will be in your initial election period, IEP or ICEP2. 6 months from the effective date of your Medicare Part B to enroll in a Medigap policy. During your IEP, there is no medical underwriting for a Medigap policy, no health questions. Medicare beneficiaries with pre-existing conditions can benefit from a Medigap policy. How can they benefit from a Medigap policy? Preset amounts, right? Go to any doctor in the country without a referral that takes Medicare, they're going to take your supplement. Total freedom of choice. Medicare Advantage plans are great. They're about the value. I pay nothing per month. in most cases, or whatever it might be. I get all these extra benefits that I don't get. I don't get dental and vision with Medicare because Medicare doesn't consider that to be a necessary benefit. Those are Medicare Advantage. So there's pros and cons to both. The cons to an Advantage plan could be plans changing all the time. Out-of-pocket max went from 3,000 up to 8,000. Supplement, you know what you're going to pay. You know you're going to spend your money per month. Yes, it's going to go up every year, but if you're unhealthy, most times you're getting your money's worth from that. Consequently, you're going to pay that whether you're sick or not. So in an Advantage plan, those extra benefits might be nice, and you could say, hey, look, it has a gap, it has a stop loss of $8,000 going up every year, but not having anything, just having Medicare A and B, there is no cap. If you have a $800,000 open heart surgery, you are going to pay 20% of that bill. There is no cap, right? Things get negotiated. I get it, but at least Advantage plans give you that safeguard of an actual stop, right? But a supplement is the best coverage that you can buy in terms of medical coverage because it gives you total freedom to go wherever you want. Doctors drop in and out of Medicare Advantage networks all the time. Your local blues tend to hold the doctors better, but again, it's up to that experienced a year, whatever it might be. They want to raise prices, whatever it might be, right? The supplement is predictability. You know what you get for that. I hate to say you get better treatment, but it's a lot easier of a process too. A doctor bills the government, bills your Medicare supplement plan. There's not a whole lot of fighting there, right? If the government approves it, so is the supplement. Government didn't approve it, supplement's not, right? With an Advantage plan, they are the gatekeeper. They get to put you through step therapy or pre-authorization, things of that nature. So there's that extra barrier. So why is there this push for Medicare Advantage? There's this push because the government looks at this of all the fraud, and it's not from you. It's from places like home healthcare groups, chair lifts, not all, right? But, fraud happens, and the fraud's facilitated on the federal level, which is a bit inefficient compared to an insurance company whose job it is to dot every I and cross every T. So I always say this to people. What's right for the government is not what's always right for you, right? What's right for your doctor is not what's always right for you. In that sense, to say, if you feel a supplement is right for you, do that. If you feel an Advantage plan is right for you, do that too. Right. Again, there's not everything has to be finalized all the time. There's ways to get in and out of things, as we discussed in this presentation. But yeah, if you ask a doctor, I can't really think of a single doctor that's going to tell you he'd rather have an Advantage plan, or she rather have an Advantage plan, or they rather have an Advantage plan over a supplement plan or traditional Medicare. It's usually a much easier process for them. I think just looking on Google or search engine, 98% of doctors accept the terms of Medicare, participate with Medicare. They might not all love the reimbursement amounts. You might be in a state where they can charge an excess charge. Plan G covers that. Where Plan N in Pennsylvania here, it's illegal for a doctor to charge an excess charge. But in New Jersey or most of the country, they can charge an excess charge. Plan G picks up the excess charge and doesn't. Aetna, just using them as example, once told me they did the study before of their plan Plan F book, right, that covered everything, and they said it's like 2% of the time again that the doctor ever charged that excess, and they usually have to tell you. And we live in the age of reviews. So a doctor who's gouging seniors and charging excess charges is probably not all too popular right now, and people are talking about it. So again, that in certain states, the doctor has that ability to do that. Certain plans cover and certain plans don't in the supplement realm. And that's just kind of the reality of the two differences. Important decisions continued. Important factors considered when comparing Medicare options: age, financial situation, health, providers, medications, and pharmacies utilized. How does Medicare coordinate with your Social Security? Well, they help them administer that Part B cost, comes out of your check, or they bill you, right? And then there's income related adjustments, which we discussed. And for questions, concerns, shoot some comments. I don't know where you're seeing this because we're putting it all over the place. But that's my info there. There's my website.